Headaches are a universal problem affecting about two-thirds of the population. In today's video, we will explore the 7 main types of headaches, what symptoms to watch out for, and how we can approach them clinically. Headaches are classified into 7 types, associated with viral illness such as respiratory infection, sinusitis, or influenza. Vascular headaches like migraines or cluster headaches, cervical headaches originating from the joints, muscles, or fascia in the neck, tension headaches often linked to muscle contraction or stress, intracranial causes including tumors, hemorrhages, or meningitis. Exercise-related headaches such as benign exertional headaches or footballer's migraine. And finally, other causes like drug-induced headaches or psychogenic factors. While most headaches are benign and don't need medical assessment, some symptoms may indicate a more serious issue. So what should raise a red flag? A new or unaccustomed headache, sudden severe onset, or one that wakes you up at night. Stiff neck, fever, or other systemic symptoms like weight loss, neurological signs like drowsiness or weakness. A headache worsening over days or with localized pain, local extracranial symptoms, and changes in headache pattern. When assessing headaches, a stepwise approach is crucial. Exclude intracranial causes. Start by ruling out serious issues like hemorrhage, tumors, or infection. Imaging such as CT or MRI may be needed. Check for viral illnesses. Look for signs of sinusitis, respiratory infections, or flu-like symptoms. Consider drug-induced headaches. Common culprits include alcohol, painkillers, antibiotics, and even antihypertensives. Evaluate exercise-related triggers. For example, benign exertional headaches or headaches related to intense physical activity. Differentiating headache types on the basis of location, onset, and triggers. Migraines are typically frontal and temporal, while cervical headaches are often occipital and retroorbital. Sudden onset could indicate a cerebral hemorrhage, while gradual onset points to cervical issues. Note food, stress, or activities that may provoke symptoms. And remember, associated symptoms like nausea, aura, or visual changes are classic in migraines, while neck stiffness might suggest meningitis or cervical origins. Here are some questions clinicians often ask. Is the pain throbbing or dull? How long does the headache last? Does movement like turning your neck make it worse? Is there a history of head trauma or illness like sinusitis? These details guide the diagnosis and ensure nothing is missed. Every headache patient should undergo a neurological exam. Key components include checking mental state, speech and gait, examining the skull and cervical spine, assessing the cranial nerves, motor and sensory systems.